everybody, welcome to Dr. Ghost YouTube channel. Prepping PG entrance one topic at a time. Please like, share and subscribe. Hope you enjoy.
Yeah, so hello guys. Now we'll talk about another important biochemistry topic which is frequently asked in our exams, which is amino acid metabolism disorders. Okay, I have written down the content for you to make the video short. Okay, so the amino acid metabolism disorders, mainly 1, 2, 3, 4 and 5, mainly 5 types are very important and are frequently asked in exams, and they were asked even in the current NEET PG exam to 2025. So the first one we'll study is phenylketonuria. Okay, phenylketonuria, it means some phenyl ketone is getting excreted in urine. Urea means in urine. Okay, so this enzyme will be deficient, which is called phenylalanine hydroxylase. Okay, now the phenylalanine hydroxylase, what's its function? Like, it's, I have made a star on this enzyme and I have written it here. Okay, the phenylalanine hydroxylase, which is a acid, okay, which is amino acid phenylalanine, will be converted by phenylalanine hydroxylase to tyrosine, the tyrosine. So the phenylalanine hydroxylase is absent, so tyrosine will not be formed, and hence tyrosine becomes an essential amino acid. Initially it was formed by phenylalanine, but since it cannot be formed now because of deficiency of an enzyme, there will be deficiency of tyrosine too, and hence the tyrosine becomes essential amino acid. Okay, so what happens is, because the phenylalanine is not getting metabolized, so it will get converted to certain products. Okay, and these are called like a phenyl pyruvate or phenyl lactate or phenyl acetate. Okay, it will be converted to these products. Now these products are mainly responsible for the clinical features which are seen in a patient or a baby with phenylketonuria, because these disorders will be present since birth because there is an enzyme deficiency. Okay, so what happens, the tyrosine, in the presence of an enzyme called tyrosinase, forms melanin. Okay, I'll write it down for you the sides. Okay, what does tyrosine do is, this tyrosine forms melanin. Okay, and this melanin is responsible for giving color to our skin or our hair. So what happens is, in the absence of phenylalanine, there will be no tyrosine, and hence there will be no melanin, so there will be no pigmentation, and the patient will have fair skin, like blonde hairs, and there will be like eyes will also be discolored. Okay, this is the reason the patient with phenylalanine hydroxylase deficiency will have hypopigmentation. If we tell it in another term, because of deficiency of tyrosine, there will be deficiency of melanin, because tyrosine is a precursor of melanin and tyrosine precursor is phenylalanine. Okay, now what happens is this, due to the presence of phenyl acetate, okay, there will be mousy or musty odor in body odor. Okay, and there will be severe mental retardation. This also has a reason, because brain needs neutral amino acids for during its development. So what happens is, this phenylalanine, which is an extra because of deficiency of enzyme, it will compete with the neutral amino acids and enter the brain. So there will be mental retardation because neutral amino acids will not be supplied to the brain. That's the reason of severe mental retardation. For diagnosis, we do ferric chloride test in urine. Okay, it will give green color. You do not need the details about it, and this is mainly because of phenyl pyruvate. I mean, this reaction is given because of phenyl pyruvate in the urine. Okay, so how do we treat these guys? Because for treatment we have to do a lifelong restriction of phenylalanine. Okay, now phenylalanine has to be restricted lifelong, because there is not, the enzyme is deficient which is required for its metabolism. Aspartame is a sugar which contains phenylalanine and aspartate, so we should avoid that artificial sweetener. Okay, also, since now the tyrosine has become an essential amino acid, we have to give tyrosine as supplementation. In the initial days we also give tryptophan. Okay, now this year they asked question about this. We have to give tetrahydrobiopterin supplementation, because it is one of the coenzymes for the enzyme phenylalanine hydroxylase. This was the option in NEET PG 2025. Now the second disease we are going to talk about is maple syrup urine disease. So the maple syrup urine disease, I hope you are able to see. The maple syrup urine disease occurs because of deficiency of an enzyme called branched chain keto acid dehydrogenase, or also called decarboxylase. I'll write down here on the side, which will be branched chain keto acid dehydrogenase. Okay, this is the enzyme deficient. So what happens, the branch chain amino acids, which are leucine, isoleucine and valine, LIV, these are converted by a transamination reaction which occurs in amino acid pathway. We'll study about it later, to a keto acid. Now these keto acids are cleared by the body by branch chain keto acid dehydrogenase. We do not need to know the detail about it. So what happens is these three branched amino acids gets accumulated, and their product which was formed by transamination also gets accumulated. Okay, so I'll write it down. What happens, these three amino acids LIV, which is leucine, isoleucine and valine, these undergo transamination, and these gets converted into a keto acids. Amino acids gets converted into the keto acids, and these are metabolized by branch chain keto acid dehydrogenase or decarboxylase. Okay, now we do not need to know the further reaction. So what happens is these three amino acids and these keto acids gets accumulated in our body. So what will be the urine odor in this condition? It will be burnt sugar or caramel. Like when we caramelize the sugar, the smell we get, that is called the burnt sugar appearance. Okay, now what there will be also severe mental retardation in MSUD, and because of that there will be high mortality. Also, since the keto acids are getting deposited, I told you there will be ketosis. Okay, there will be ketosis. Now to treat this, what happens is all the dehydrogenases in our body requires vitamin B1, which is thiamine. So we'll give vitamin B1. Okay, we'll give vitamin B1, and also we will restrict the branch chain amino acids because they cannot be metabolized. Lifelong restriction of these branch chain amino acids. Okay, like we restricted phenylalanine in the first disorder, will restrict leucine, isoleucine and valine in the maple syrup urine disease. Okay, now the third disorder which we are going to study is alkaptonuria. Alkaptonuria is also known as the black bone disease. Okay, black bone disease, it is because of deficiency of an enzyme called homogentisate dioxygenase. Initially it was also called as oxidase, but nowadays the name has been changed to dioxygenase. Okay, so what it does is it converts homogentisic acid in the presence of homogentisate dioxygenase to some product which we need not know. So what happens, since there will be deficiency of this enzyme, the homogentisic acid will be elevated in our body. So there will be elevation of homogentisic acid, and now the homogentisic acid gets oxidized, it will also appear in urine since it is increased in our blood. So the clinical feature in alkaptonuria will be the homogentisic acid will be passed down in the urine, and upon oxidation it turns into black, so there will be black urine. Okay, so remember that there will be no mental retardation in this disease. This is an important point, no mental retardation. Now what happens is this homogentisic acid also get polymerizes. This polymerization leads to the formation of alkapton bodies. Now these alkapton bodies will get accumulated in cartilage. Now the cartilage will turn black because of alkapton bodies, and in connective tissue it will also turn black, and in the intervertebral disc, which will lead to back pain. The blackness in the cartilages and connective tissue is known as ochronosis. Okay, this is just the term for black connective tissue and cartilages like nose, pinna, they will turn into black, and also the eyes conjunctiva will turn into black. This is known as ochronosis. Okay, and because of that only, since it will also get accumulated in connective tissues, it is also called the black bone disease. Okay, we talked about it earlier only. Now the next disorder we are going to talk about is albinism. I already told you that the tyrosine gets converted to melanin. This is with the help of an enzyme called tyrosinase. Okay, now this tyrosinase enzyme is deficient in a disorder called albinism. Okay, now the tyrosinase is an oxidase. Okay, this enzyme is an oxidase. Now all the oxidases require copper. Okay, so tyrosinase will require copper as its cofactor. Okay, so what happens, melanin will not be formed, and the patient will have hypopigmentation similar to phenylketonuria, but there will be no mental retardation in this disease. This is how we distinguish phenylketonuria from albinism. There will be hypopigmentation in both the disorders, but there will be no mental retardation in albinism. Okay, we all know that this another disorder of hypopigmentation which you all will study in dermat is vitiligo. Okay, so in vitiligo, how to differentiate vitiligo? In vitiligo there will be patchy hypopigmentation. Okay, patchy, and there will be tyrosinase will be normal. Okay, tyrosinase enzyme will be normal. Now the last amino acid metabolism disorder we are going to study is homocystinuria. It is very important, very commonly asked in exams. Cystinuria can be of two types, which will be due to acquired one. The first one will be acquired, and the second one will be genetic. Okay, the acquired one is due to deficiency of B6, B9 and B12. See how the B6, B9 and B12 deficiency will cause homocystinuria. We'll study in this slide. So what happens is this homocysteine gets converted to methionine in the presence of folate, which is vitamin B9. Okay, and vitamin B12 to methionine. Okay, and also homocysteine gets converted to cysteine in the presence of an enzyme which is also known as cystathione beta synthase, CBS enzyme. Homocysteine gets converted to cysteine, which requires vitamin B6. Okay, see how we can relate now. If the vitamin B12 and B9 is deficient, homocysteine will be elevated. Obviously okay. And also if vitamin B6 is absent, there will be elevation of homocysteine, okay, because they will not be converted to their respective products. So this is how acquired homocystinuria is caused due to deficiency of vitamin B6, B9 and B12, okay. Now, so if a patient has homocystinuria, acquired homocystinuria, how we will differentiate that it's due to vitamin B6, B9 or B12 deficiency? So what will be the substrate accumulated in each of the vitamin deficiency? See, homocysteine will be elevated in all the three deficiencies, so we cannot distinguish it on the basis of homocysteine. So we need to find another product which will differentiate the deficiency, and we can find out what's the deficiency, okay. So in case of vitamin B6, homocysteine will be elevated substrate which is accumulated in the body, and also xanthurenic acid will be accumulated. In case of B9, homocysteine will be accumulated, but there will be Figlu test in urine will be positive, okay, for aminoglutamic acid. It's called, not very important, the full form is not important, just remember the name Figlu test will be positive. And in case of B12 deficiency, there will be elevation of homocysteine as we saw in the previous slide, and also there will be accumulation of L-methyl malonic acid, very important point, okay, repeatedly asked in exams, L-methyl malonic acid, okay. So this is how this is all about acquired homocystinuria. The second type of homocystinuria is genetic. This is because of deficiency of enzyme cystathione beta synthase. I already told you this enzyme converts homocysteine to cysteine, and in the absence of CBS, the homocysteine will be elevated, causing homocystinuria. So what happens now? The patient with homocystinuria will obviously have some clinical features which are very important to diagnose the disease. They will present with lens dislocation, which will be inferonasal. In Marfan syndrome, we see superiotemporal lens dislocation. Now there will be osteoporosis, okay, and there will be early age MI or stroke. These three will be present. You can diagnose it as homocystinuria. Early means early age. A patient of 15, 16, 17, 18 years getting MI or stroke is very rare. We all know it's a disease of like old age, okay. So a patient in adolescent age getting MI or stroke is very rare, and we should check their homocysteine levels. Now the homocysteine levels will be checked in serum. It's called homocysteine level, which the compound will have SH group, but in urine they will form homocysteine. The two homocysteine will get bonded together by SS bond, sulfur sulfur bond or disulfide bond, and will form homocysteine, okay. There is a test done which is cyanide nitroprusside test, which is not very much important, but it's positive in this. Also there is a cystinosis, which is a lysosomal storage disorder. It will also, cyanide nitroprusside test is also positive in cystinosis, which is a lysosomal storage disorder. So this is all about the amino acid metabolism disorders, which are important from exam point of view. One last slide we need to remember is about the different odors in different diseases or amino acid disorder, so that if a question mentions these order, we can easily get to know what disorder they are talking about, okay. Although we need to see the other clinical features, but these will be the clue. So as I told, in phenylketonuria there will be mousy odor. In diabetic ketoacidosis, since keto acids like acetone will be accumulated, there will be fruity odor, okay. In tyrosinemia, which will be type 1 tyrosinemia, which is due to deficiency of FAAH, not very important, I'll talk about it in coming videos. There will be cabbage odors. How to remember it? Now how you can remember it, I'll tell you. What cabbage, you can see it starts with cab, so cab. Now cab does have tires, okay. So cab tire, the tire will remind you of tyrosinemia, and the cab will remind you of cabbage odor, okay. There will be now hypermethonemia. There will be boiled cabbage odor. Now methionine malabsorption syndrome, which is also called oat house syndrome, will have beer odor or oat house odor, okay. Now Hawkins synuria, like Hawkins is a bird, okay. We can remember this Hawkins blood around a swimming pool, so there will be swimming pool odor. Now isovaleric acidemia, sweaty feet odor, and multiple carboxylase deficiency will have tomcat urine. You can remember with three words: TCU is equal to MCD. Tomcat urine is equal to multiple carboxylase deficiency. So in isovaleric acidemia, you can remember I have sweaty feet, okay. Isovaleric acidemia, I sweaty feet, okay, like this you can remember. So that's all about the amino acid metabolism.